Hey familia, welcome to your healthy dose of spice. Today we're going to be talking about inflammation, and this is actually going to be an entire series. So if you have questions about inflammation anywhere, feel free to drop them in the chat, or if you're watching this on the replay, use hashtag replay and drop any questions. I'll be sure to address them. I'll put them up on the screen, whatever it might be. And actually, speaking about putting things up on the screen, let me put that. So again, we are doing a live definitely Q&A. Bring your questions. We're going to talk about inflammation head to toe. Let's go. We're going to go through all the systems. This is going to be a series that I'm going to do. So today I'm just going to talk about the head and the face and inflammation, what you can look out for, what you can see, what you can do about it, what it's doing to your body, because inflammation is pretty serious. So we're streaming to a couple of different platforms. We got YouTube, Facebook, LinkedIn, and Twitter over here. And I was going to try to do my Instagram, but I forgot. So I'll upload this later on to Instagram. But anyways, feel free to drop your questions. I'd love to give you a shout out. So inflammation. We're going to talk about the head. We're going to start up here first. And so inflammation, first of all, is, I like to equate it to things that are red, irritated, angry. That's what I call it, because that's what they are. They're irritated, they're angry. And when I speak about they, I mean the tissues, the blood vessels, the arteries, the muscle tissue, connective tissue, all of that. All of those things can become inflamed, angry, irritated. And there's a number of reasons why they can become that way. And there's also something very easy, very natural that you can do that doesn't involve steroids or medications. We can treat things a lot more naturally, and actually getting to the root cause is going to be more beneficial for you than trying to be more reactive and trying to, attack the stuff when it gets really out of hand. So if we are looking at the face, and we're going to talk about inflammation first, let's talk about eyeballs. And so your eyeballs actually have very tiny, teeny, tiny blood vessels and arteries going to the muscles, nerve, connective tissue, all of that. And so you can get inflammation in this area. So you can see the redness sometimes, but also, especially with diabetes, right? We have neuropathy. You can get optical neuropathy. You can get glaucoma, macular degeneration. These are all issues that have to deal with blood flow. They really do stem from blood flow, because blood flow feeds the nerve tissue, and nerve tissue becomes damaged and things cannot work properly. And then that's when you have all that degeneration and all of those problems with your eyesight. So in the eyeballs, the high levels of insulin, high levels of glucose, those all lead to inflammation. And all that inflammation causes a lot of those eye issues that you could be experiencing. We can look at the face, and I've done lots of videos recently about your face and about inflammation in your face and how you can see it just by looking at your face and knowing kind of what's going on inside of your body just by looking at your face. So the skin is a really great indicator of people's health, and especially their face. So if you're experiencing a lot of inflammation, you're going to see it in your face. And I know in my videos I talked about, not just seeing people's weight right in their face. Inflammation looks different than fat. Okay. And I could talk about fat face because I was over 70 pounds overweight. I had a fat face for most of my life. And so I know what a fat face looks like, but inflammation face looks different. There is like an undertone, a redness, a flushing that comes with it. The way that it is distributed on your face, it's not really how fat distributes. Inflammation distributes a little bit differently. And it's really difficult for me to put this into words, because it's kind of doing visual assessments has kind of become like my superpower to say, because I can look at somebody and pretty much figure out in a few seconds what's going on with them. But that only has come because of I've had over like 20 years of looking at thousands and thousands of patients and clients and seeing people in all different stages of health. So I can just look at somebody and do a pretty quick, thorough assessment and know what's up. So I can just look at somebody and know what's going on with their health on the inside. So I can tell by somebody's face and looking for inflammation and how severe it is. And so from the inside, you're going to see that ruddiness, that pinkness projected, the shape, the distortion. You'll see it from the outside. But what you're going to see on top of your skin, right? Because the skin gets fed from underneath, right? But then we also have this top layer of skin now. We all see that we put all our makeup and all our junk and our lotions and our potions on. So the problem becomes when we get prescribed creams and lotions and potions, like I just said, and we're just slathering it on the outside of our skin, and that's not really doing anything to resolve the symptoms. So maybe you have been prescribed creams and prescription creams or lotions, and you're trying to put them on your skin, and you're not really noticing any improvement. That's because you really need to heal the skin from the inside out. You need to, because all your blood and all the inflammation and the insulin and all of that is feeding into your skin, and your skin is your largest organ. And so your largest organ, your skin, is going to show whether or not you are healthy on the inside or your levels of inflammation. So a lot of the inflammatory conditions cause you to have outward signs of skin conditions. And I had dealt with a lot of like eczema type issues, especially on my cheeks, for such a long time. And they kept trying to prescribe me all these steroidal creams, and nothing was ever helping. And it wasn't until I addressed my underlying issues of inflammation that I was able to resolve all of that. So now my skin looks great. I don't got to, I think my skin looks great. So I'm not shy to say it, but that's because I do a lot of work with my nutrition and with my intermittent fasting and working out. So I do a lot of the things to address the root cause, which is the inflammation, which is caused by a poor diet, lack of exercise, stress. All of those things lead to inflammation. So once you can address those things, and you'll start to notice the difference on the outside in your skin. So this is just one of the ways that the inflammation can show up in your skin. Also, looking at people's tongues, sticking out your tongue. You want to go to a practitioner who tells you to stick out your tongue and looks at your tongue. And as growing up in healthcare, not growing up, being in healthcare, it feels like I grew up in healthcare because I spent like over half my life in healthcare, over 20 some years. Looking at people's tongues is part of an assessment. It's part of somebody's body. So we look at somebody's tongue to see what's going on, because the tongue can tell you a lot about somebody's health as well. So if I'm seeing a client virtually doing telehealth, and be like, hey, stick out your tongue. Let me see what's up with your tongue. So I'll look at somebody's tongue to see, is it coated? Is it dry? Is it cracked? Is there ridges? What's it shaped like? Like, there are so many things you can tell from somebody's tongue. And a lot of that oral health issues you can pick up just from your tongue. And actually, side note, a lot of the oral bacteria that you have is actually beneficial for your heart health, and because it contributes to nitric oxide production, which is great for lowering your blood pressure. But a lot of people do a lot of these really harsh mouthwashes and stuff that really kill all that bacteria. And all that bacteria is actually beneficial for your heart. But that's another topic for another show. But just looking at somebody's tongue, you can look for levels of inflammation in the tongue as well. So that's another area. So I hope this has been kind of helpful. Like I said, we're going to talk about inflammation, but we're going to go by parts. Head to toe assessment, right? Head to toe. We're just going to start with the head today. So we talked about the eyeballs and vision changes. If you notice your vision start to change, it's due to inflammation. The blood vessels are becoming constricted. There's a reason why things are happening. Your body is always speaking to you. Your body is always telling you what's going on. So if you're noticing vision changes, it means that the blood vessels are constricting. Something is happening up here. Go see your eye doctor right away. Let them know that you're noticing this and see what they say. And if they tell you that they're seeing levels of inflammation, there's a reason why. Treat the underlying reason. Address your inflammation. What are you eating? What are you doing? What are you drinking? Are you intermittent fasting? What are you doing to bring those insulin levels down naturally? Okay. Looking at your skin on the outside, really take a good look at yourself. Don't put no filters on, don't put no makeup on. I did a whole video of me with no makeup on or nothing, putting on a face mask. Like, I'm not afraid to show my skin because I worked really hard to get it to a place where it's at. But I dealt with eczema and chronic dry skin and peeling and all the lotions. My mom used to always take me to the dermatologist because my skin was just a disaster. So all that peeling skin, cracking, the oozing, the weeping from that. There's people that deal with that on the daily, and then they try to cover it up with all this makeup and the contouring and all this shit, and it does nothing. It really does nothing, because you're never treating the underlying condition. You're just trying to cover it up, and it's not a way to live your life, to always be having to cover up and hide. It's not a way to live your life. So treating the underlying inflammation is really going to be the secret for that. So what you're eating, your insulin levels, your glucose levels, your stress, really focusing on proper nutrition, vitamins, minerals, electrolytes, doing IV hydration therapy to fix some of those imbalances to really nourish your skin from the inside out. Okay. And when we get down to like the tummy and the gut, we'll talk more about that. But I'm just talking about up here for right now. And then your oral health, looking at your tongue, examining it. What does it look like? Get to know your tongue. What does your tongue look like? What is normal for your tongue and not normal for your tongue? I'm always such an advocate for knowing what is normal for your body versus not normal, because no two bodies are the same. So get to know your body and what's normal for your body. That way, when something starts to change, then you can pick up on it right away and be able to be more proactive and empower yourself when you do go see a provider, that you can tell them, like, this is not normal for me. So what's going on? I think something's wrong. Okay. I'm all about that. I'm all about empowering you to take control over your health. So that is my video for today. If you're watching this on the replay, definitely let me know. But drop any questions that you have about chronic inflammation. Again, we're going to go from head to toe. And I think in the next video that I'm going to make tomorrow, I'll talk about lungs and heart. We'll go to that area next. And then probably after that, we'll get into joints and the muscles and all of that. But definitely some things to look out for, and definitely nutrition, movement, stress, intermittent fasting is amazing for this. Treating the underlying conditions of inflammation. There are specific diets, specific things that you can be eating, specific things to not eat that can to naturally lower your inflammation levels. Okay. And insulin and high glucose go hand in hand with inflammation. Those are all bad news when you're having those together. Those drive high blood pressure, those drive type 2 diabetes, those drive insulin resistance, metabolic syndrome. It just cascades. It just turns into a big old web of nasty mess. And I don't want you having to deal with that. So there are simple, easy things that we can do to get you back into balance. Okay. All right, guys. Like I always say, for a balanced life, just add spice. I'll catch you mañana for the next video.